The seventh meeting of our Senate Standing Committee on Health Services. Appreciate everybody being here this morning. Anyone have any guests they want to recognize before we get into the formal business? Seeing none, Becky, if you would, please call the roll.
Senator Rocky Adams, Senator Berg, Senator Carroll,
Here.
Senator Douglas,
Present.
Senator Herron, Senator Mills, Senator Nemes,
Present.
Senator Rawlings,
Present.
Senator Tishner, Vice Chair Richardson,
Here.
Chairman Meredith.
Present. We do have a quorum and duly constituted to conduct business. We'll jump right into our agenda. First on our agenda is Senate Joint Resolution 116. We'd welcome President Stivers to the table. It's very infrequent that you're here, President Stivers, but always an honor and pleasure to have you in our committee.
Mr. Chairman, thank you, and members of the committee, appreciate the opportunity. If I may proceed.
Yes, please.
Okay. This is something that you were intricately involved in and helped me, whether you knew it or not, kind of formulate this thought process. Understanding that we have underserved and unserved areas in the healthcare realm or universe. There are statistics in Senate Joint Resolution 116 that talk about where we have these problems. We have 3 institutions, 2 that are currently operating and graduating doctors, a 3rd that will come online in the next few years at Eastern Kentucky University with the osteopathic program. They being state entities, we can direct them. We hope that they will engage other entities like UPIKE, which is private, like the Kentucky Hospital Association, like the Kentucky Medical Association, the other associations that may be in the realm of healthcare, to come up with solutions, since they are basically going to be the largest providers of what I would call at the top of the, for lack of a better term, food chain of healthcare, the doctors. And then it kind of comes down to them. And people may disagree with that, and I understand that, but we get into these turf battles about where we need something, and we've gotten it into this trauma issue with your bill, Mr. Chair, that, we want something. We would prefer to have a physician, but if you don't, what's the next best thing? Well, we would like, in my opinion, I think the people in the state of Kentucky would like to see us populate those areas, and it may, or come up with alternatives to population of those areas with, as you educated me, like avatars, creating the networks and links with the universities, so there's immediate access in Harlan, Kentucky to one of the teaching universities. So what this joint resolution does is it directs UK, U of L, and Eastern Kentucky University to look over the next year to come back with a good framework and plan on how we serve the full state of Kentucky with health care. To me, they would be the people, since they are the teaching schools for our physicians, to look at this and should know whether it is, loan forgiveness, scholarships, recruitment, technology, what are all the different assets we could use? What are the different pieces of the puzzle that we can put together to better serve the Commonwealth in the delivery of health care? That's the resolution, Mr. Chairman.
Question from committee members or comments? I have one, President Stivers. I know you've had conversations, obviously, with the EKU and UK and U of L. What's there been an initial reaction to this challenge? Because it is substantial.
Actually, I was with the head of U of L Healthcare, who happens to have family members in Jackson County, Kentucky, which is part of my district. They were very open and thought it was really good. I've actually heard from Eastern that the 2 presidents of the university talked since this was introduced about how they wanted to move forward with it and felt very comfortable in the collaboration. Then I will, if I can, the KMA, who I think is behind me, says they want to get fully engaged, and I think these associations need to be fully engaged in this. But we can't direct them. We can direct the other three.
True. What do you think during this period our legislature's involvement will be, if any at all?
Actually, I hope that as they go through this, that they will be briefing us, because this time next year will come faster than what any of us believe. You know, as we always say, we'll be back in 9 months. Hopefully they will be engaging us to kind of keep us updated as to what they are looking at. And some people may say this is a short time frame, but look, we've known this for years. And people should have some pretty distinctive and well-formed ideas already. It's just putting them together, and then, you know, is it a financial issue? Is it a logistics issue? Is it an education issue of educating people about, hey, these things are available? I remember a young man from my hometown that when he was a freshman scored 35 on his ACT and didn't think that he could get accepted. Well, that was just, I mean, as smart as he was, it was like, wow, you know, get accepted and hopefully you come back home.
And that just adds to the challenge, because this is quite a mosaic that we have within healthcare, and we talk frequently about the social determinants of health, and certainly poverty plays a big part of that. And Purdue cite the statistic, I believe that some counties in eastern Kentucky could lose 40% of their population over the next, I think, 20-year period.
Between now and 2050.
So that's another challenge that plays into this, but I appreciate your resolution. Senator Carroll?
Thank you, Mr. Chairman. Along with what the President just said, what are the numbers of students and that are being turned away from medical schools that they just simply, I mean, they just don't score high enough, or for whatever reason? How many more slots would we actually need to be able to maximize the applications of those that are legitimately
Senator Carroll
suited for that path, I guess?
Senator Carroll, I'm not so sure that that's just one part of the equation, because there are students, and I'm going to look at the two doctors who are here, that there may just be a smidgen's difference between that one that gets accepted and that one that doesn't. That's one part of the problem. I think another part of the problem, and maybe even larger than that, is that of the students that we educate, they don't necessarily stay here, or they don't get dispersed into the right areas. So that, to me, may be as big a problem as the numerical figure of those that are admitted into the programs. And I would defer to the two doctors on that, but I think they get over 1,000 applicants at each school, but only accept a few hundred.
Senator Douglas?
Thank you, Mr. Chairman. I have more of a statement than a question, if I may.
Please.
Mr. President, what I really want to do is tell you how much I appreciate this resolution. You know, I just jotted this down when I was sitting here listening to what you were saying, and I just want to say I appreciate the continued movement to direct our universities to work together in coordination with one another, allowing them to step outside their silos and to better serve the people of the Commonwealth. You know, it really is vital here in the Commonwealth that we keep pace with the changing landscape in the healthcare space, so that we can serve our people here in the Commonwealth in the future. So I really want to thank you for what you're doing here today. Thank you, Mr. Chairman.
Just final comment, President Stivers, follow up on a point you just made. We know there's a shortage of physicians. United Healthcare publishes an annual report, kind of state-by-state analysis, and the one they did that was released back in October showed that our shortage is not as severe as other states. So suggest, or one of the issues may be a maldistribution of physicians, and that's something that's certainly going to have to be factored in. But any other questions, comments from committee members? If not, I entertain a motion. Just, President Stivers, yes, please.
You know, Mr. Chairman, you and I have discussed this, and it is with a certain sense of passion that I say it. I live in a small town. I think our population might hit 1,000 on a good day. But we are extremely fortunate. We have the only Advent Healthcare hospital in the state. They are a much, much larger system further south. They are a mission hospital under Advent. So they're really not a profit motive to them. They've invested over $40-some million into my community in the last 5 years to upgrade that. You and I have had this discussion. They have approximately 600 employees, and people look at me and say, "Why are you doing so much for the hospital?" I said, "Well, you know what? I want to tell you, I'm trying to recruit a business that employs 600 people and has a payroll that's twice the size of the local Board of Education." And they said, "Wow, that's really great. Who is that?" I said, "The hospital." So thinking of the health care that we have access to that very, very few small towns have is wonderful. But then thinking of the economic engine that it is for my hometown is really quite unbelievable. And when we have these deserts, unserved or underserved area, this is not just a healthcare issue. It is, and truly, you've helped. I listen to you. You have helped me formulate a thought process, because it is both healthcare and economic development in places that are woefully underserved in both.
We do have a tendency, I think, to look at healthcare in a silo, and you made the point, obviously, we haven't. Remind the committee members, we had our Secretary of Cabinet Economic Development here a couple summers ago to talk about what I call the Danny Bentley Fund. It's a fund for hospitals that are struggling. And he made the comment, unprompted by any of us, that he can't recruit a hospital, can't recruit an industry to a county that doesn't have a hospital. So that's part of our challenge, too. If we're going to lift up the economy of Kentucky, we have to make sure we have a foundation throughout Kentucky to support healthcare and education. But I again, appreciate this resolution. Other comments? Again, if not, entertain a motion. We have a motion. In a second. All those in favor vote aye. All opposed vote no. Please call the roll.
Senator Rocky Adams, Senator Byrd,
Explain my yes vote.
Yes, please.
First of all, I really apologize for being late again. It was pouring rain out there. This is just awesome. I mean, this is, and I talked to KMA about this recently. I hear about the shortages of physicians in this state and how we need to basically alter the requirements for who's doing what, because we don't have enough doctors. And so we're having to rely on mid-level providers. And unfortunately, I can hear some really bad stories. I could share really bad stories about what that leads to. And it is, as far as I'm concerned, the responsibility of the physicians in this state to take a hold of this problem, because the best way is to take your best and your brightest and train them and keep them. So first we have to identify how many of our best and our brightest can we accommodate? Where do we train them? And how do we keep them? And that is an issue that I think we need to discuss in this legislature at some point, because a lot of my colleagues do not feel that this legislature is friendly to physicians. and they leave because they have a lot of options. So there's multiple issues here, but I do believe it is the responsibility of the medical community and the responsibility of the universities in this state to get together and address and fix this need. So thank you, sir.
Senator Carroll.
Aye.
Senator Douglas.
Vote aye. I'll explain my vote.
Yes, please.
Thank you, Mr. Chairman. You know, it doesn't happen very often, but I certainly agree with Senator Berg, and she and I, we laugh about this all the time. It really is something that we in the healthcare space need to get a hold of. As you know, Mr. President, I have three kids, all three who are not just practicing medicine, but they're specialists in medicine. None of them chose to stay here in the Commonwealth. And I really appreciate my colleagues here in the General Assembly and how hard everybody is working to try to change the environment here in the Commonwealth so that we can attract more physicians. But I've been speaking with a lot of my colleagues in the healthcare space recently, a little bit louder, asking my colleagues to come along and be partners and work with us so that we can improve the environment. We got to know what we need in terms of changing the environment to make the environment better. Thank you, Mr. Chairman.
Senator Herron.
Yes, can I explain my yes vote?
Yes, please.
Yes, first I'd like to apologize for being late, but I was listening on the way in. I am a yes on this. And yesterday I spoke to the folks at Eastern Kentucky University, and one of their asks is also expanding their medical education programs. And so I completely support this, and I am hoping with that, with this, and then also supporting EKU and the things that they're wanting to do, that we can help fill some of those gaps. Thank you.
Senator Mills. Senator Nemes.
Aye.
Senator Rawlings.
Aye.
Senator Richardson.
Aye.
Senator Tishner. Chairman Meredith.
Aye. Vote is unanimous. Senate Joint Resolution 116 passed out of committee with favorable expression. Thank you, President Stivers, for being here this morning.
As a committee, it's always a pleasure to come before you all. Thank you.
Sir. Next on our agenda is Senate Bill 116 with Senator Scott Maiden. Good morning, Senator.
Good morning, Senator Meredith. How are you this morning?
Glad to have you here this morning. If you would, introduce yourself and your guest, and we'll proceed.
I'm State Senator Scott Maiden, Senate District 29.
Andrew Rutherford. I'm a critical care PA and chair of the Government Affairs Committee for the Kentucky Academy of Physician Assistants.
Erin Chalmers. I am a PA that works in education and also in pediatrics, and I'm the president of the Kentucky Academy of Physician Assistants.
Please proceed.
Thank you, Mr. Chairman. I want to first start by saying that I appreciate all your help along the way with this bill. And as you know, we started back during the interim on this bill, and it took a little while to get to where we are, but it was good. When I walked in, I saw both sides speaking this morning, and I said, well, I'm glad you're all talking. They said, we're actually planning a golf trip. So it's pretty good when you can get to the end of the process and both parties are going on a trip together. But I do appreciate the help of it. And, you know, this bill that I'm getting ready to speak on is basically is right in line with what President Stivers just talked about. You know, I got involved in this because of access to rural health care. You know, in rural health care, you've probably heard Senator Meredith say many times, we've got 40% of the population in rural health care in 107 counties, and we've only got 17% of the doctors. So, yeah, we would all like to have doctors in our hospitals and our emergency rooms, but it just ain't going to happen. I had no idea until I got involved in this bill that we actually have 8 counties that doesn't even have a doctor in it. 8 counties in Kentucky doesn't even have a single doctor. So this is about access to care. It's certainly, Dr. Douglas, I know you mentioned this on the floor the other day on Senator Meredith's bill. It's not to disrespect doctors by any means. I think we all hold them to the highest esteem, and I know the doctors that I've talked to, and my own personal doctor that works with a PA and an MP, you know, loves them because, you know, it gives her she sees 40 plus patients a day. She probably would see 15 if she didn't have the NPs and the PAs charting, writing prescriptions, setting the next appointment. So I hope y'all don't think that, by any means that we're taking a shot at the docs. It's if we could, we would have doctors in our hospitals. It's not money. It's just, as you said, your 3 kids got educated here, but they left, so it's, there's several factors in it. But Chairman Meredith, I think we have a committee sub on this.
Yes, we do. Is there a motion on the sub? Second. Motion is second. All in favor say aye. Aye. Thank you. Please proceed.
So when we started and filed this bill back, I guess, the start of the session, the PAs were wanting to move from a supervisory model to the collaborative model, which all the states around us, Ohio, West Virginia, Tennessee, Missouri, Illinois, and Indiana, currently have that process that they do. After several meetings, one-on-one with the PAs, several individual meetings with these folks here behind me, joint meetings, they met together. They were able to work this out, and that's why we have the committee sub. The committee sub basically is where all the meat of this bill is now. The actual bill itself has pretty much been changed by all of that, and I could sit here and tell you all about the bill, but I'm going to let this gentleman here, who has a much better handle on it, to explain it to you. So when Dr. Berg and Dr. Douglas have questions, you'll be able to answer them better than me.
I'm gonna let Aaron take.
Huh?
Question, Senator Nemes?
Yes, I have a question. Thank you for bringing this and trying to put a Band-Aid on a problem. But as we just heard in a Senate joint resolution, we know we need doctors out there. So as the UK and U of L and Eastern study this and decide how to get doctors out in the field, if we do this encroachment of the doctor's authority, then do we need doctors out there? Are we not going to be able to use those doctors? So why do we need to try to get doctors out there if we're going to encroach on there?
I would think we're going to always need doctors. I mean, I think you heard my speech on the floor a couple of weeks ago. My whole adult lifetime, all I've heard in rural Kentucky is, that we need more doctors. We need more doctors. For instance, in my hometown where I live, mine's just a little bit bigger in President Stivers. I got about 2,000. I think we have 5 practicing doctors, and they're all over 60. So, it's going to be a constant doctors going off, needing doctors come in. So, and you don't replace the experience and the knowledge that those guys have worked 40 years. So, yeah, I think we'll always need them. In rural Kentucky, they now have these rural health clinics, and a lot of these doctors are going to work for them because they're not on call. They don't have to provide their malpractice insurance. They don't have to manage their workforce. So a lot of the doctors are gravitating toward that rural health care because they're on a salary. They don't work weekends. They're not on call. That's what really has hurt us more than anything. And I love my rural health clinics because they provide a lot of service. But they've taken all of our doctors. The doctors that we had left have went to, every single one of them went to work for those clinics. Of course, you know why? The federal government created those years ago, and the reimbursement rates on those rural health clinics are like 3 times higher than what the doctors can get if they have their own practice. So they get paid more. They get paid good money. They're working 5 days a week. They're not on call. So, yeah, Senator Nemes, I think we're always going to. I hope we get to a point where we don't, need more doctors, but I doubt that you and I will see it in my lifetime.
I thank you. It's a little bit of a difference of opinion because as we teach doctors and keep them here, and like you said, we can't change we lose the experience. We're also, if we keep doctors from going out into the areas, we lose the education of an MD on someone that's not an MD also if we let them work out there. And let's face it, they're going to be getting paid close to what doctors are going to get paid if we continue to encroach on them. So why would someone want to go to MD school and when they don't have to go out in the rural areas? And
but I'm going to let him address that, Senator Nemes, and they don't make nowhere close what a doctor does. I actually ran a hospital for a while, and I've got a lot of numbers on that, but I'll let him address that for you.
So totally understand where you're coming from. I think you and I discussed this, sir. One of the things with the committee sub that we did is we worked with the Kentucky Medical Association. We took input from physicians. We also took input from hospitals. And what this legislation does now, it continues the supervision model. So there's no way I can actually ever replace a physician in the sense that I can't get a license without a physician and they must sign off on anything I do when it comes to what I can prescribe, how I can practice. The big thing with this is it's just going to allow our teams that we have now to be more efficient and to be utilized better. For myself, I don't disagree. I think we need to figure out how we can have more physicians. I'm not here advocating saying we should do away with it. I think it's wonderful that we worked with KMA as much as we did this year, and I'd love to see that moving forward. I think it's one of those that the healthcare system continues to evolve, and that includes healthcare teams. And I think this legislation helps set forth what a really good healthcare team looks like and can better utilize our services as a PA.
Well, I appreciate you bringing this, and it's definitely something that is needed now, but I still toil with the future of we have diminished the health care that could be in the future. It definitely will help it for the immediacy. Thank you.
Senator Burke.
Thank you. Thank you for this legislation, sir. This is, as far as I'm concerned, exactly how we would like these type of I don't want to say conflicts, these type of discussions to take place and to come to resolution and to be able to come to us with a solution that satisfies everybody and continues to fill the needs in a safe manner. I mean, as far as I'm concerned, this is what we want. So thank you. And I do want to, there's so many different types of providers. I want you all to understand PAs have the closest relationship with their physicians. These are the people who are most highly trained behind MDs. So it's a very, very important relationship and one that needs to continue. So thank you.
Mr. Chairman, can I follow?
Yes, please.
I agree with Senator Berg, and that's why we strung it out so long, and I don't like to pick winners and losers, and I know you don't either. It's best if we can all, it makes it a whole lot easier on us when we take that vote on the floor, I know that.
To that end, we have a motion and a second. All in favor of the bill will vote aye. All opposed will no. Becky, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
No, but explain my vote, Mr. Chairman.
Yes, please.
Mr. Chairman, I certainly appreciate Senator Maiden and all the hard work, and I appreciate all the physician's assistants because we have some wonderfully trained people here in the Commonwealth. I would like to address some of the shortages. When we look at when we take a look at the data, looking at the average physician shortages here in our country, the average number of doctors is about 457 per 100,000. And in Kentucky, it's 42.6 doctors per 100,000. So I get the emphasis on all the physician shortage and how we need to expand all this stuff, but reality is a little bit different than the fear. And there's no doubt that when we do some of the data gathering, and I've done this with some of the researchers, I asked them about whether they're talking to people in private practice or talking to people in academia. And they spend a lot of time with the academic people and a lot less time out in private practice. So we skew a lot of our studies, and that really pains my heart if we're really trying to fix something. The last thing is we're now starting to see some of the effects of not just our academic medicine, but our corporate medicine on our medical structure here in the Commonwealth. This is one of the reasons why we need to take a look at the maldistribution of physicians throughout our Commonwealth. And I'm not sure that this is the way to do it, Mr. Chairman. But thank you very much for at least letting me say that.
Senator Herron. Aye. Senator Mills. Aye. Senator Nemes.
No.
Senator Rawlings.
Aye.
Senator Richardson. Senator Tishner. Chairman Meredith.
Aye. Vote is 7-2 in favor of the bill, so it passes out of committee with favorable expression. Congratulations, Senator. And look
Thank you,
forward to
Mr.
talking about it on the floor.
Thank you, Mr. Chairman, and I do appreciate all your help during this time because you've
Thank
been
you.
a lot of help. Thank you.
Any other business to come before this committee? Seeing none, we stand adjourned. Thank you.